Hello and welcome to Healthy Baby, Healthy Mama, presented by Kaweah Health, your parent portal to help you unravel the tensions that come with this exciting new chapter in your life with the help of our health experts and other parents themselves. So grab a snack, sit back, and let's write this pursuit of healthiness together. Welcome to our second episode. I'm Maria Rodriguez, your host, and I'm so excited to present our very special guest today, pediatrician and mom herself, Dr. Ester Flores. Welcome.
Thank you.
We're so excited to have you because rumor has it that patients absolutely love you. Tell us about it.
Well, first of all, thank you very much for everybody, all of those that took their time to spread out a good word and just say good things about me. I really appreciate it. Thank you. I think I love what I do. I love babies. I love children, teenagers. So I'm just happy every day when I go to work to be able to help and see children thrive.
You interact with them in such a special way. Off camera, we're talking about the fact that you don't wear a white coat. So tell us about that and how that helps you build rapport and connection with your patients.
I just choose not to wear a white coat because I feel they get scared or it might look scary for them, especially if they're coming there for the first time and they're already sick, not feeling very well. So I just stopped wearing a white coat, or sometimes I try not to wear scrubs too.
The amazing thing about Dr. Flores is that what you see is what you get. I mean, she is always this bubbly. This is just who you are. This is what you present to your patients, and patients and parents absolutely love you. So thank you for joining us, and it's going to be a great episode. But before we continue with your expertise, besides being a doctor, a physician, a pediatrician, you're also a mom of two beautiful daughters. Tell us about them.
Yeah, definitely being a mom, that's my favorite title. I feel it's a hard-earned title, but I absolutely love it. It's my greatest blessing.
What's your favorite memory with your two girls?
I think probably when I first met them, it was just, I guess, sounds cliche, but love at first sight, and just completely changed my world as soon as I saw them.
I think it's very interesting when we sit down with a doctor like yourself. You're obviously usually on the other side helping moms and dads care for their children. And this episode is specifically caring for kids, right? You help parents care for their kids. But how does it feel to be on the other side as a mom, because you recently had your second daughter?
I think, it has its pros and its cons. So maybe sometimes you worry a little bit extra, but it also, helps to kind of navigate it a little bit more confidently. I still obviously don't take care of my own kids. Even me and my husband are both pediatricians. So they have their own doctor, and I like to trust my doctor, so I try not to check them too much and stuff like that. I still take them to the doctor.
I didn't know that. That's interesting, because as a pediatrician, I would think you want to be hands-on about the care of your children, especially because your husband is also a pediatrician. How do you navigate that?
I mean, I just try to be a mom, and, if I have questions, I'll ask the pediatrician as well. So I just try to kind of not go into too much thinking as a doctor. I'm also a mom, and I may make mistakes too, so I just prefer to trust somebody else and make sure I'm being objective, or that person is being objective, and not giving my own medical advice for my kids.
As a pediatrician, for those who don't know, what kind of patients do you see and care for?
So a pediatrician is a specialty who takes care of babies since they're newborns and all the way until they go into adulthood at 18 years of age.
Do you have any subspecialties?
Yes, so I've had several areas of interest throughout my career, and so shortly after I became a pediatrician, I did a mini fellowship in mental health for primary care in pediatrics. And that means I take care of children with ADHD, autism, aggressive behavior, depression, anxiety, just to mention some.
I think it's such a privilege that at Kaweah Health we have a pediatrician like yourself to care for our children, especially after COVID. We've seen post-pandemic, the mental health cases have grown tremendously among our kids. Have you seen that in your practice? How do you navigate that? How do you work with parents to ensure that their children are back to school, doing what they love, interacting after everything that happened?
Yes, for sure. We did see a rise on those mental health illnesses, or even one of the ones that already were diagnosed were having some exacerbations of their conditions. And I think it's only natural because they were going through a lot. So yeah, we definitely saw those, and even a little bit more traffic in the inpatient setting as well for mental health illnesses. So it's great to have a support. Kaweah recently started having more support for mental health, so I'm happy to be part of the care for the community.
When you mentioned Kaweah Health has grown more, what do you mean by that? What other avenues or support, what types of support has Kaweah been able to contribute to ensure that the mental health of our children is better in Tulare County?
We have mental health services, which are rare to find in our community, and not only in our community, it's just rare to find it nationwide. So it's something very particular and specific that is just great to have. So we have outpatient services for mental health for pediatrics.
That's amazing. So as a pediatrician, what common illnesses do you see when children come into your office? What are the most common illnesses you're seeing, especially for newborn babies?
There's quite a variety. It's hard to say, one, but it's maybe newborn rashes are very common, belly button concerns. Sometimes also they might have jaundice, breastfeeding issues, which I forgot also to mention. That's one of my other specialties. Lactation and breastfeeding medicine. So I love to help babies with breastfeeding and moms as well.
I love that you touched on that, because in our first episode of this podcast, it was all about breastfeeding and how we help our patients go through that journey. How do you help patients as a pediatrician? Obviously, you have this as part of the care that you provide.
Yes. So, breastfeeding sometimes can be easy, but I feel that's like minority of the patients have that luck or blessing to just go through breastfeeding very smoothly. A lot of times we can encounter many challenges, whether it's coming from baby or from mom. So I'm happy to support them in any issues they might have with lactation and breastfeeding.
Did you have, as a mom, that experience for lactation? Did you have any problems? Do you connect with moms when they're going through that journey?
Yes, absolutely. I think that's one of the reasons why I decided to go into this specialty, because I felt that breastfeeding was something natural and it was going to be really easy, and I just had to put the baby and latch the baby and just it's going to be smooth. It didn't happen for me. I had a lot of struggles. Any struggle that you can think about it, I think I had it. And I was struggling to find the support. So I felt, if me as a pediatrician, I'm having problems finding help and finding resources and just, having a hard time navigating with the lactation, I thought, it's probably worse for other moms. And so that's what made me go into pursuing more education about breastfeeding medicine. I joined the Breastfeeding Academy for breastfeeding medicine, and I started doing a lot of work in that area.
I love that you bring that and you connect so deeply with the topic, because I feel that the listeners are going to see, if that's a pediatrician, goes through this journey and she's struggling, what about me that I don't know about the resources? If you put yourself in their shoes, how did you go through that? Because obviously there's also postpartum depression. There's a lot of things that come out after.
Yes.
How did you navigate that, even though you knew about the resources? And how does Kaweah Health, how can we aid in patients as well?
Yes, absolutely. I think there's a lot of issues that happen that maybe are not talked about too much. I feel there's a lot of focus on the baby when they're preparing, but sometimes we leave the mom behind, or not arm her with all the tools and support that she might need. So that's definitely very important, because although this podcast is called Healthy Baby, Healthy Mama, we also need a healthy mama to have a healthy baby too.
Absolutely, I love that. So Dr. Flores is here not only before the care or before the delivery of the baby, but afterwards. And that's why we wanted to have you here, because you go through the journey, and as a pediatrician, you see kids until they're 18 years old. So you follow them, you see the different stages of their lives.
Yes.
You become kind of a part of the family.
Yeah, that's, very important, and it's just thrilling for me to be able to be a part of their growth in life.
I love that. So we're going to switch gears a little bit. We're in respiratory illness season, right? So it's the season where we're seeing more cases of flu, COVID, and RSV. And RSV specifically affects children for the most part. So what is RSV, and how can we help our children stay safe during this time?
So RSV stands for respiratory syncytial virus, and it's a virus that produces different symptoms. It can be just a common cold in older people, but in very young children, small babies, it can cause bronchiolitis or other severe respiratory illness. And it's the first cause of hospitalizations in babies under 1 year of age.
How common is it? When you're in your practice, how often do you see babies coming in with RSV?
So we don't routinely test everybody that comes in with cold symptoms for RSV, so it's hard to have good numbers and data on it. Most of the times we end up testing them if they're very young, already showing signs of bronchiolitis, so probably those numbers are going to be underestimated for RSV in general. So if you have, kids at home and you have older kids, they might just show up with a cold, but if you have a 3-month-old baby, then, they might show up with bronchiolitis, and then that's when we might realize that it is RSV.
So what type of symptoms should parents look out for to ensure that, this might be RSV and I probably should take my son or daughter to the doctor?
Once the respiratory symptoms are more kind of like on the low respiratory tract, which means having difficulty breathing, or their rib cages are just kind of like flaring or moving up and down very fast, or abdominal breathing, like belly breathing, just breathing very fast. Any type of noise that you're hearing, it's coming from the chest. Baby's not drinking well. Baby's not looking very active. All of those are signs of bronchiolitis.
And is it important to have the newborns or babies get vaccines to help them protect from RSV and other illnesses?
So the RSV vaccine is a very new vaccine, so that's good that you brought it up. We didn't have it before, and it's very brand new. So it's indicated for only babies at risk, especially now because it's so new. We do have a shortage of the RSV vaccine, but it definitely will decrease the mortality or morbidity, meaning less admissions or less severe illness from RSV.
How does a vaccine work? So we're saying it's such a new vaccine for children. How does it work? Is it supposed to prevent RSV? Will it help make the symptoms less severe?
Vaccines in general usually decrease the complications of the disease, not necessarily prevent the disease itself. The same thing with the flu vaccine. So it doesn't prevent from children getting the flu itself, but it will decrease the chances of them getting pneumonia or severely ill to be admitted in the hospital. So similarly to that, it's the RSV vaccine will hopefully prevent admissions due to RSV, so pneumonia, respiratory distress, and potentially death.
What's the best advice to keep children healthy?
If you are a parent and you're concerned about your baby, don't hesitate to bring them to the doctor. Sometimes as parents, we might feel that something is maybe silly or not too important, but if it's making you double think and it's making you be up at night and it's just making you not feel comfortable, just trust your parents' instincts and don't be scared about bringing it up to your doctor. And I'm happy to help at any questions that you might have.
I'm glad you brought that up because we're going to switch gears just a little bit and talk about you. So the fascinating thing about you is that you're bilingual, so you speak Spanish fluently, which means you're able to reach more patients, connect to more families in Tulare County, and really connect with our pediatric patients. You were actually born and raised in Honduras in Central America, so tell us a bit about that and why you decided to become a doctor, a pediatrician, and how that passion has kind of fueled into this love for helping children be safe in our county.
Yes, so I grew up in Honduras. So Spanish is my first language, and I loved it when I came into Tulare County just to connect with patients that speak Spanish as well. I feel sometimes the moms can send their kids with me with their grandparents if they don't speak English, and I can help them that way. So definitely in some of the, I guess, cultural differences that we might have, I'm very aware of those. A lot of, practices that they might have that are maybe different, so I can definitely relate to many of those.
What's your favorite part about being a pediatrician?
I think I get to see cute babies all day, but two, I think I can feel the impact I'm making in their lives, and making sure that I catch any developmental problems that they might have early, and just change their whole prognosis. And I can feel the difference that when we catch these conditions early, they just have so much better prognosis in their life and better outcomes that, it's just very meaningful.
Obviously, this podcast is geared to parents, so when they're listening to this, we want them to take away important information, help educate them on their journey. Is there anything that you think in particular you want parents to take from this podcast when they hear you as a pediatrician or as a mom?
I think, as I said before, just bring out any questions you might have to the doctor. We're happy to help, happy to answer any questions. It's not easy to take care of kids, so don't take on an extra load on top of you of trying to figure out medical things. Just, bring them up to us, and we'll be happy to help.
So grab a pen and paper, because I'm going to ask you this next question. You mentioned know the topic. What do you want to ask your pediatrician? What are the most important questions we should be asking to ensure that we're seeing a great pediatrician and that we are asking the appropriate questions to ensure children are safe?
I think I think it's hard to come with like general questions and that suits everybody. I think each family will have different questions, different experiences, and some parents already have kids at home, and so their experiences even with a different child is going to be definitely different. So it just kind of targeted to each parent's experience.
It's so easy to go online and say, my child has X, Y, and Z, and you look and there's so many diagnoses on Google, right? And you start freaking out. What does this mean? So how do we, as a mom and as a pediatrician, how do we ease ourselves up, understand that we probably should relax, don't go to the extremes, and go to your pediatrician? So how do you navigate that when you get those concerns?
Yeah, I think Dr. Google can scare you. And so I think it's maybe especially if you're getting a lot of like weird things that come up, because very rare diseases and illnesses are going to show up if you do a search. So I think it maybe is going to add a little bit more anxiety. Maybe something simple as over-the-counter medications, stuff like that. I think sometimes it's helpful, like to look out for a dose or something like this, something simple. But if it's like something else, especially if you're just making a compilation of different symptoms, I think it's always a good idea to go to the doctor.
We have two urgent cares in Court and Demery, and they're great to take care of our patients. So that's another option.
We also have the prompt care at Ben Maddox.
Correct.
So the same office where I'm practicing at, we also have, it's kind of like urgent care. It just doesn't have x-rays on site, but we do have the services, so you can definitely bring the kids on other days that I'm not available.
What's the best gift that parents can give to their children during this holiday season?
I'd like to say that a perfect gift is a memory. So children are not going to remember what you bought for them or what toy they had last year, but they will sure remember the time they spent or something fun that you did with your kids. So just take the time to build a memory and take a lot of pictures so they can remember too.
I love that. Is there anything else, Dr. Flores, that you want to address or help our parents understand during this podcast?
I think, you guys are already doing a great job. Just being parent, just by being a parent is already a lot of work. So keep doing a great job. Keep those babies happy and healthy. And for any questions, just bring them to me.
This is who you are with patients, and that's why patients feel comfortable coming to you. And babies return. And so they might cry on the first visit, but then afterwards they're okay, right?
Yeah.
Dr. Flores, thank you so much for being with us here today. And to all of you, our viewers, we appreciate you listening in and watching, and we hope you share this great information. So, Dr. Flores, thank you so much.
Thank you.
And remember, we're here to help you and join you on this incredible parenting journey to ensure that you have a healthy baby and a healthy mama, one episode at a time. Till next time.